I am so delighted to meet Dr. Carmela Britt. She's going to be doing a big presentation, maybe more than one, at the VMX veterinary conference that I'm going down to in Orlando. And Carrie, thank you for jumping on and taking time. I'm sure you're having to put together PowerPoints and all kinds of complications because you have to talk to a whole bunch of other vets and be impressive. You are impressive because you're a sports medicine specialist, but one of the things that most interests you is how to keep older pets mobile. And that's of great interest to me because I see so many people with older pets dragging them along a sidewalk and the dog is limping. Dog is lame, dog's in pain. People aren't even noticing. They go, well, he's old. And I think, no, he needs help. So is that one of the things you hope people come to you at Care First in Raleigh, North Carolina, come to you and say, I think I have a problem, and then you help them solve it before the dog is basically crippled, right?
Yeah, no, it's absolutely true. And one of the things, the main takeaway for my veterinary colleagues is that we have this sort of, oh, it's just an old dog, and that's what old dogs look like.
Yes.
And I want to denormalize the old dog concept because I think that is really a disservice. I am so lucky to be a veterinarian in a time where so much medicine, technology, medications, treatments are available. And I think thanks to my colleagues in general practice, dogs and cats are living longer and longer. But
Mhm.
now we have to be prepared for that. So we can help them with their chronic diseases. We can help them with excellent preventative care, but we have to be prepared for what the result of that is, which is now we have an aging population of pets. And I'm so passionate about helping them. I have this conversation almost daily with my clients, and there's so much that can be done. I think people get intimidated sometimes about going to see a sports med rehab person. And
Yes.
I love my sports med patients too, but I also love my geriatric patients. And you don't have to commit to rehab if you come see me. I can give you stuff to do at home. And I hope my veterinary colleagues at this conference, that's really my goal, is to give them some practical stuff that they can help their patients with too. But you're absolutely right. It's a huge passion of mine. I love the old dogs and they deserve a tender care and just as much interest as our young puppies and our happy, healthier younger dogs do.
Definitely. In sports medicine, you're dealing with agility stars and champions and dogs who leap over high buildings in a single bound. And they're really cool. And they definitely need you because they need to be held together, just like human athletes do, with all kinds of preventive and corrective and supportive care. But the old dogs still, just like some of we old people, they still have a young puppy heart. And they'd still
Mhm.
like to run, they'd still like to play, but it hurts. Or
Yeah.
their joints don't move as well, or they're just their body parts are not their friends anymore. And is that sort of what you do, is refamiliarize themselves with their body in a way that feels okay to them, where they can do stuff?
That's such a great way to look at it. And I think that it's definitely part of that. One of the things that I love recently is I've started actually having an increase in caseload of aging sporting dogs
Ah,
because at some point they do age out, they stop
yeah,
competing, and they've worked their bodies really hard for their whole
yeah,
lives. But their heart and their drive is unchanged. And
yeah,
so, how do we help their bodies match that? They still want to do their tricks, they still want to do they're have a job. So they've had a job their whole
yeah,
lives and they want to still
yeah.
have that. And so it is really interesting to see the spectrum of the aging sporting dog versus the aging pet. We call it pet level fitness.
Oh, that's
And
cute.
yeah, and so it is true that there's a really good study that came out of Cornell vet school actually looking at how can we assess older dogs, and it's really looking at functional assessment. So you bring up making them more aware of their body. The first step for me is pain. So, a huge part of what I do is manage pain. And that's a lot of what I hope to speak about at the conference is that I think with our older dogs, we get really worried with what medications, what supplements
Mhm.
can we do because they often have other things going on. They might have some kidneys that aren't functioning as well or heart function. And so, how can we manage pain? Because that's really the limiting factor. And we can't ask them. And often people say, I don't know how you do what you do because you can't ask them where their pain is. And I can't ask them, but I can watch the way they move. I can feel the way their bones feel, their joints move. I can feel their muscles. I can feel tension in muscles. And that can tell me a lot. And when I feel things that indicate pain, to me, that's number one, because I can't help you move better if you hurt. And it's a vicious cycle,
Right.
right? If you hurt, you stop moving. If you stop moving, you hurt more. And so
Yes.
that's really a lot of what I do in the first 20 minutes of my conversation with my clients is I think we need better pain control. And how can we do that safely with your pet, given all the other things it has going on?
And you often have to say that even to people who might be giving occasional Rimadyl or Deramax, they're giving a kind of a dog Advil, if you will, but not giving it consistently, or maybe not giving enough, or maybe not in combination with something else. Is it a very primitive take two aspirin and see me in the morning in the old-fashioned human doctor way? Is that sort of the takeaway they've had from their own vet, even if that's not the only thing their vet said?
Sure. I think it's a combination of things. I think that as dogs age, we get more nervous, as even as veterinarians, we get more nervous about giving them more medications. We worry about side effects. We worry about existing disease. So I think that from my colleagues who are in general practice, who are the first line seeing
That's
these
right.
patients, they're being cautious, understandably, because they are managing a lot of other things with these patients. And so there's a little bit of that. I think there's so much data out there. It's hard to sort through what's actually truly evidence-based for my colleagues to pick
Yeah.
from a study that really did show a difference versus just what they think is going to work or what's worked for them in the past. So I think that's a component of it. I think sometimes we get worried with what we call multimodal management. So we want to just give one medication, hope it works. When we start adding combinations,
That's right. You
certainly
don't
there
know
are,
what worked.
yeah, and we don't know what worked, or we don't know if them together is going to have an adverse reaction.
Right.
And I certainly have had patients come to me where they're in such bad shape that I don't care what works. We throw everything at them and then we take
Yes.
things one away.
Mm-hmm.
But I think that's from a management standpoint on the veterinary side, I think that plays a huge role. I think from a client standpoint, it's hard to see those changes. I think that as dogs age, it happens so gradually. And I've
Yes.
had this in my own experience and cats too, that you just adapt to the next level and you adapt to the next level. And so this sort of slow, gradual loss of robustness and slow decline just becomes a little bit less noticeable. So when the dog has a big day, friend comes over, holidays, and they're visibly more sore, then the owners say, "Oh, let me give you a Rimadyl. You're really sore." And it makes sense to them. We did more things today. You're sore. But that sort of gradual, slow decline is harder to recognize for all of us. I've had it, my personal experience with my own pets. It's because you're just with them every day. So I think it's a combination of those things that contribute to that.
In the way when you see a child or a puppy grow, it's incremental. All of it, oh my goodness, you grew
Yes.
out of your clothes, or a puppy grew out of his collar for the third time. But you
Yep.
didn't really notice it happening. And when the older dog has trouble getting up from lying down, it maybe was a little bit of trouble a year ago and a little
Yep.
more trouble 9 months ago. And now you wince and grimace of the dog because the getting up is really miserable. So
Yep.
you think, oh, this is what old dogs do. But not in
Yep.
the modern world, as you said, there's so many options.
Yep.
But both for the owner and for the everyday vet, there's a lot of options. And as you said, who's going to sort through it? What if there's this great study, even through Cornell? Oh, wait, it was only 8 dogs. And oh,
Yeah.
wait, they didn't have a placebo. They looked at 8 old, crotchety Labradors and they did X, just this one thing that the company had to pay Cornell to do the test. And it wasn't a fake test, but it wasn't good science. And now it said the dogs are better. Oh,
Yeah.
immeasurably. They walked on one of those pressure pads. They're walking better. But the thing is, it was only 8 dogs.
Yeah.
It wasn't compared to giving them, I don't know, whiskey and milk. I'm making that up. But we don't, it has to be done in a way that it's really scientific because it costs not just money and time for the vet, but time is short. So if you're talking about an 8, 9, 10-year-old, especially large breed dog, you don't have 6 months to fiddle around and
Yeah.
try something that has a low chance of working. So, what do you think in general about the injectables that have come along? There's a couple of them without naming the names of companies or the product, but they're supposed to be, if you will, a magic shot for arthritis,
Yeah.
joint pain.
Yeah. I don't think there's any magic shot. I think that so a couple points that you were mentioned that made me think of this. So you're absolutely right. So veterinary studies tend to be very small. We look at human literature. They have thousands of people over 5 years. Ours are
Yeah,
short and quick, and we do claim to be evidence based. And then the reality is we're doing the best that we can with what we know.
correct, correct.
And I think one of the things that my mentor, who is another phenomenal sports med rehab vet, Leilani Alvarez, up at Animal Medical Center, and that's where I did my residency. One of the key points she shared with me early in my residency was that as a specialist, you're the keeper of the latest knowledge. That is really your
Right,
responsibility. And so I took that to heart and I try to practice that way. So when I'm working with my colleagues in general practice or even in other board specialties, I see my job as being the keeper of that, of the latest knowledge, the latest evidence based, and the person that should look at it critically. Was this a good study? Did it have a control?
right.
How many animals? Was it a good study design? Were the statistics appropriate? So we spent a lot of time in our training, our board certification training, looking at how to appropriately read journals. And I have
Yes.
taken that to heart through my career. That really is my job as a specialist. That's what makes me different. And I jokingly tell people I wouldn't have the faintest idea what to do with a vaccine reaction, but I can tell you what the latest medications are to treat arthritis. And I think that's the wonderful world of having specialty medicine and veterinary medicine, which is not that new actually, or not that old actually. So it's not like
That's
specialists have been around forever.
really interesting because I don't think that's an equivalent in human medicine. People who are
Sure.
people who are specialists in various fields in human medicine, they're not checking out supposedly peer-reviewed journal entries or articles or New England Journal of Medicine and thinking this could have been a better study. They're not doing that. They're doing what
Yeah.
they've always done. This is not to in any way disparage human
Sure.
neurologists or human rehab people, but I think it's really interesting. It was at the Animal Medical Center in New York
Yep.
where you study, because that's one of the extraordinary places on the planet, the only nonprofit uh,
Yeah.
teaching hospital in the veterinary field. And a lot of the most extraordinary vets have come out of there. So I guess you're a shining example of that. But it's a really interesting point because it doesn't equate to human medicine. Once a neurologist, once a cardiologist in human medicine, I'm not saying they don't read the literature, but I don't think they see themselves as keepers of the flame of emerging knowledge. And maybe it's because in veterinary medicine, there's so much emerging knowledge. It's a
That's a really
constant
good point.
flow. It's like a fire hose
Yeah.
products being invented and created and tweaked, especially for joint supplements, right? That's a
Yeah.
tricky one. A
Yeah.
lot of them are designed by veterinarians, even veterinary nutritionists, but how do we know as end users, as you might as
Yeah.
well call pet owners or clients, how do we know which is the good joint supplement? So how do you handle that? Because you've got to give very specific advice and choose products. They don't want you to say, just try anything,
Yeah.
right?
It's so funny because that's a very good point, and that I think that is also something else that I try very hard to focus on is how do I guide my patients and my clients to the best possible option, because the supplement world is very unregulated
Yep.
and really they can say anything they want. And oftentimes what's in the supplement isn't double checked, it's not
Correct.
verified.
Could be too
So
much,
it could
not
be
too
too
little,
much. And there's a study actually that came out of Florida that showed that that does happen. So there can be 9 times the amount that they say is in there,
or
which,
none at all, or
or none at
something else
all.
entirely.
Yeah, it is scary. And it's also under, I think people don't take them seriously because they're supplements, they're natural, they're
And
nutraceuticals. They just don't worry that there can also be side effects from them. So I have 3 criteria, which again, I credit my mentor for training me this way, that I
okay,
look for in a supplement. Number one is I really want them to have done a safety study because to me,
okay,
part of my oath as a veterinarian is to do no harm. And so
right,
if I'm going to recommend something that may or may not work, I want to know it's safe. And so that's a
right,
really important aspect of it. And that doesn't happen in all studies, but it does in all supplements, but it does happen in enough that I can have a few in my toolbox that I feel
right.
comfortable with. The next one is it's really great if they've done an efficacy study, and those efficacy studies probably are in 6 dogs, and they usually do
Because
have a
they're
control.
expensive. It's
Yeah,
actually really
exactly.
expensive to do any.
Exactly. So having an efficacy study, ideally in the species they recommend it for, because just because it worked in a cat doesn't mean it's going to work in a dog, and vice versa, or even exotics or people. And then the last very important criteria is that they participate in third-party laboratory testing. So there is a National
Right,
Animal Supplement Council,
there is.
and any supplement that has that little yellow seal means they're voluntarily participating in that. It's a very complex process. It's a longer conversation than today, but it
Right, but it
essentially
really is
means
important.
it is important, and they are double checking themselves, and they don't have to be part of that. So that kind of all of that together leads up to a reputable company, a place that is investing in their product. They believe in their product, they're investing in their product, and they're trying to provide evidence-based and safety for them. There's a lot of supplement companies out there that do the clinical trials, but they don't publish the data in a peer-reviewed journal. And to me, that doesn't really help me because I want to know that someone else looked at your data, someone else looked at your method. And
Yeah,
even if you sponsored the study, you can never, there's always a worry that there's a bias there. But even if you sponsor the study as a company, if you publish it in a peer reviewed journal, you take some of that away because you've had someone else evaluate it and look at your
right.
methods. So I think there are ways to navigate the supplement world. And that's how I try to practice. And I try to have a group in my toolbox that fit those criteria. And I don't always. There are certainly some that fit two of the three or one of the three, but I've
Right.
used for a really long time. But for the most part, and I tell my clients that, I share that with them. I say, the reason I'm recommending this supplement is because of these reasons. And it gives them a confidence to know that someone has done the research for them. Now, if they come to me and they say, I've had my dog on this,
Right.
I do try to do my due diligence. I tell them probably not today, probably not tomorrow, but hopefully next week I can come back to you with some information about this product. I've never seen it, I've never used it. So there is certainly that aspect. I'm always open-minded and willing to learn about new supplements. I certainly, the supplement world is, I say I'm the keeper of the knowledge, but the supplements, there's so many new supplements all the
Right. Yeah.
time,
Yeah.
it's hard to keep track of. So that's how I navigate this. And the other thing that I share with my clients is if you come to me and your dog has been on this supplement for 2, 3 years and you say it made a huge difference, I absolutely say, then keep it. As long as it's not causing any problems, as long as your dog is doing well, I absolutely trust my clients. I think when a client tells you that they feel like something works in their patient or in their pet, it probably does. And that's really important.
That's a really good point. But on the other hand, I'm coming to see you because I've had my dog on the supplement for 3 years, and my dog much better the passage of time. But might it
Yeah.
be that the amount that was useful, the amount of the ingredients that were useful to my dog over the last 3 years was enough, and now it's not, and he needs something stronger, something different, or as you said, a multimodal, more things, or also some exercises from you, some stretches. Is that one of
Yeah.
the things that you have owners do is stretches and massage? Because we can't do water treadmills at home. It's awkward. Kind of the living room all wet.
I absolutely do. And what I will share with you is that I practiced rehab for a year and a half, over a year and a half after residency without an underwater treadmill. So I think the underwater treadmill, everybody loves it and it is
Right.
a great tool and it's so fun to watch dogs in it and the dogs
Yeah.
that love it are really great, but it is by no means the only tool that we have to help
Right.
animals when it comes to exercise. And there's a really great study that I'll talk about at VMX2 that came out recently looking actually really at primarily home exercises and
Oh,
improved stifle knee function. And that study is just so heartwarming because I think a lot of times in my heart, when I do these home exercises, I hope they work out. A lot of times I feel like they do, but now to have a study that showed that owners can
that's
do things
nice.
at home is just a really nice, it's a good feeling because I
Yeah,
think not everyone can come to rehab. And that's also a message that I would share with my veterinary colleagues. Not every one of your patients is going to be able to get to rehab,
that's right.
and they might not even have access to it because there are very few of us.
That's right.
And so it's hard to see us. And if you're dealing with an old dog, if you're in a place where there's limited access or that person, it takes 3 months for you to get in to see them, that's really, like you said before, time is of the essence. There is so much that you can teach an older dog to do at home. And we really focus, just like in people, on activities of daily living, functional mobility.
Yeah.
ability to get up to go potty, ability to
Yeah.
get up and get water, ability to go get their food. And there are quite a few exercises. Massage and stretching is always good, but I will tell you that stretching and massage is actually really hard for owners in my experience.
I've never done it because
Yeah.
I would go to do it. I go, oh, you didn't want me to do that. I did it wrong.
Yep.
I don't know how to do
Yep.
it. I'm not
Yep.
trained. I was just curious if you tell
Yeah,
people. I'm
I do, and I do help people with that. And there are some people that are good at it, but I've just found, at least this is my personal clinical
right.
experience, that it's hard for owners. And I
Yeah.
always joking, I don't know if, there's any people who watched the Friends show years ago, but there's one
Right.
episode where Monica is giving Chandler a massage and he's grimacing the whole time. He's like, "Yeah, you're really good at this." And I like think about what's happening with my pets and my
That's
animals at home.
great. That's great. It's a skill. It's a gift.
Yep, it
It's
is.
it's different than just being a loving owner. Well, I
It
think it's
is.
really great that you have hope for these older dogs, but I think also part of it is how to reach people through their everyday vet is the way you reach them. Obviously, you can't take a billboard somewhere and say, "Don't give up on your old dog. If he's limping, he's in a lot of pain."
Yeah.
You don't want your dog to be in pain, but people don't see the limping as pain because the dog isn't
Mhm.
shrieking, crying, yelping. The
Yeah.
dog is just suffering stoically as dogs and cats do.
Yeah. Yeah.
So, how much exercise is a kindness and helpful, and how much is torture with
Yeah.
an old dog? What we say about old horses is you never leave them in the stall, depending on
Mm,
the weather where you live. They should be outside all day. If you
yeah.
have a turnout, if you have pastures, because they're moving and
Yeah.
standing still for an old horse, at least, is really bad.
Yep.
It gets stocked up, they swell up, everything just slows down. So, what do you think about the least thing you can do with a dog who's really hurting to keep him?
Yeah.
It shouldn't be, it certainly shouldn't be jogging with them, heaven forbid, but even forcing them to walk when they're like, oh my God, this is painful.
Yeah.
Then what?
Yeah. So that's a great question. And that is often what owners do. They panic, understandably, because when they do finally recognize pain or they're like, "Oh gosh, things have gotten bad," they stop.
Right.
And that's the natural reaction, and it makes perfect sense. But that's the opposite of what you want them to do.
That's
So we
right.
actually do have an older study, it's pretty old now, but looking at dogs with hip dysplasia who then had arthritis. And we actually know that dogs who get more than 60 minutes or more of low impact exercise a day do better than those that get less. So it's
Wow.
to your point, it's the type of exercise that you
Yeah.
do, and that's what's important. So it's full circle. So number one is my goal in speaking at VMX, and why I like to lecture about senior pets and geriatric medicine, is pain management has to come first because that's crucial.
Yes.
And then once you get the pain better controlled, and you may not eliminate it altogether, but you want to get it better controlled, then it's movement. So movement is life, mobility is life. And if you're not moving, you're not going to do okay.
Yeah.
And so we have to get them on slow, controlled walk. There are ways to make it easier for them. You can do it on soft ground. So avoid
Right.
sidewalks, go to a park. You can take slower, more frequent walks and just go at their pace. One of the big things that I talk a lot about with my clients is postural strength. So dogs lose their ability to hold posture. So one of the most common things I hear on a daily, weekly, if not daily basis is he goes for walks just fine, but when he's standing in his food ball, he lays down or he splays out. And that is so classic of our older dogs because those are the muscles that they lose. So
Right.
they can use momentum, they can compensate. Dogs have four legs to compensate with, so they can
Right.
switch and move and figure out a way to keep going. And if they have that drive for the walk, they're going to do it. But then they go to stand and they've lost their core strength. And so
Right.
doing yoga poses, teaching owners how to do basically yoga for dogs at home so that they can build those core and balance proprioception can really make a difference. So there are lots of low impact exercises that can be done to help dogs at home. And there are a few that I think are safe to show my colleagues in general practice that are not going to harm a dog because they're functional. Things like standing on an uneven surface or doing a couple sit to stands to build that. We
Right.
call them doggy squats to build the functional strength. Now, you don't want to do 20 of those. So it's all in
Right.
caution because if you do
Right.
20 and you have a dog with really bad lower back, they're going to be in so much pain. But if you do three or four at the end of your walk every day, you're getting that strength in as well. And the other thing
Well,
I always talk to people about is you don't want them to pay for it later. So whatever
right,
exercise you're doing, if they're fine a couple hours later or the next day, you're okay. If they're not, you have to adjust it because
you
that's
overdid
your
it.
metric. Yep.
Yeah. Carrie, we've run out of time. The docs at VMX have such a treat in store for them because they're going to go home
Thank
with
you.
all kinds of great advice for their people and their older dogs and their older kitties. Thanks for your passion for what you do and for sharing it with all the other docs and for being part of the Animal Medical Center, amazing angels that fly out of there all over the country. It's really great to meet you. And I look forward to trying to find you at VMX and being a fly on the wall when you give that good advice to all the docs. Thank you for being here.
Yeah, thank you for having me. It was a pleasure. I really enjoyed it. Thank you so much.